Welcome, everyone, and thank you for joining us for today's webinar, Protecting Public Health from Wildland Fire Smoke Under Increasing Prescribed Fire. My name is Samara Mentley. I'm a project coordinator at the National Environmental Health Association, or NEHA for short, and today I'm going to be your host. To begin today's webinar, I am going to provide just a brief overview of who the National Environmental Health Association is and what we do. I'm also going to provide some details about our 2025 annual education conference. Then we will introduce our speakers who have an amazing presentation planned. And then when the presentation is complete, we'll have a Q&A session that's going to give you an opportunity to ask any questions for our presentations. With that, please allow me to cover just a few housekeeping items before we get started. Please note that the webinar is being recorded. The webinar recording is going to be uploaded to NEHA's air quality webpage. If you have any questions for our speakers during the presentation, please use the Q&A box at the bottom to submit your questions, and we will attend to them after the presentation. At the conclusion of the webinar, you will receive a link to take part in an evaluation survey that's going to give you an opportunity to provide some feedback and comments on today's webinar. So for those of you who may not be familiar with NEHA, I'm going to provide just a brief overview of who we are. We support the environmental public health workforce. As an association, everything that we do is to build, sustain, and empower environmental public health professionals so that they are equipped and prepared to protect the health of communities all across the country. We support environmental public health by continuously providing the most up-to-date trainings, tools, and resources to the workforce who specialize in so many different fields considered environmental public health. NEHA is really focused on increasing the knowledge and the tools across all of our fields to build upon our workforce capacity, efficiency, and effectiveness. We also offer credentials to certify the expertise of our workforce. In addition to our large online library of trainings, seminars, and available tools and resources, we do host an annual education conference. This includes multiple sessions that are focused on many different fields of environmental public health. Some of the topics go from policy and regulation, extreme weather preparedness and response, food safety, private wells, water quality, climate change, wildfire response and recovery, and so many more. So speaking of our annual education conference, or AEC for short, we're calling for our abstracts for our 2025 conference, and that's open until September 27th, 2024. Our conference is an opportunity for you to share your expertise. It's when you can showcase your research, your projects, and your innovative practices. It gives you an opportunity to be a part of the conversation, to contribute to advancing the field by sharing your knowledge with your peers. And it also allows you to engage and network. By presenting your work, it gives an excellent opportunity to connect with professionals in the field. Now I'm going to hand it over to Megan Christian, Chief of Staff for the Center of Public Health and Environmental Assessment, to talk more about the Office of Research and Development at Environmental Protection Agency, as well as introduce our guest speakers. So Megan, the floor is yours.
Hello, everyone, and thank you to Samara, Chris, and NEHA for having EPA's Office of Research and Development here today to present on prescribed fire, and public health. As mentioned, my name is Megan Christian, and I'm with the EPA's Office of Research and Development. And just a bit of background about us. We are the R&D side of EPA. Our acronym is ORD. And we aim to provide the best available environmental science and technology to inform and support human health and environmental decision-making for federal, state, tribal, local, and community partners, and to address critical environmental challenges and anticipate future needs through leading edge research. As you can see on the map, we have many laboratories and research facilities across the country. We're organized by different centers and offices that focus on different environmental and scientific fields. And our diverse portfolio is divided out by environmental issues that are related to air and climate, water, chemicals, homeland security, sustainable and healthy communities, and health and environmental risk assessment. With me today are Jason Sachs and Sarah Coefield from EPA ORD's Center for Public Health and Environmental Protection. Jason is a senior advisor for Wildland Fire Science with expertise in the health effects of wildlands fire smoke and the relationship between prescribed fire and wildfire. Sarah is a Federation of American Scientists Smoke Impact Fellow and has extensive experience and expertise around wildlands fire smoke issues, including wildfire smoke readiness and prescribed fire smoke management, with over 13 years of experience with Missoula Public Health. With that, I will hand the video over to Jason and Sarah.
Thanks, Megan, and thanks to NEHA for having us here. And we're happy to give a presentation on protecting public health from wildland fire smoke under increasing prescribed fire. Next slide, please. Before we jump into the presentation, I just need to display this disclaimer. Next slide, please. Great. So there's been a changing landscape of wildfire in the US over the last 30 years. We've seen a rather steady state of the number of wildfires that are happening each year, but we've seen a dramatic increase in the acres burned. And this increase can be attributed to a number of factors. A few of the most prominent, though, are a changing climate and over 100 years of fire suppression. An ancillary factor that contributes to this increase in the risk of fire ignitions is the growth of the wildland-urban interface, or WUI. As more people are living closer to wilderness areas, the chances for wildfire ignitions increases. And a byproduct of this increase in acreage burn that we're seeing is an increase in the amount of smoke emitted. So wildland fire smoke, and I note wildland fire here to represent both wildfire and prescribed fire, is a complex mixture that includes a number of pollutants. And of these pollutants, when we think about smoke, we tend to focus on particulate matter, or PM, because it's one of the biggest components of smoke. What is PM? Well, particulate matter is a mixture of solid and liquid droplets, and particles can be emitted directly from a source, such as a fire or a smokestack, or particles can form through complex atmospheric reactions of chemicals that are emitted from some of the same sources that directly emit PM. PM is classified into different size fractions based on the aerodynamic diameter of the particle, but each of these size fractions still represents a distribution of particles that people are exposed to. And so of these sizes, fine particles, also referred to as PM 2.5, is the size fraction of greatest health concern, as there is well-documented scientific evidence demonstrating its health effects, and also evidence showing that these particles can be easily inhaled into the body, where some can reach the lower regions of the respiratory tract. And some of those particles are able to translocate out of the lung into the bloodstream, where they can affect other organ systems. It really hasn't been until about the last 10 years that we've had an expansion in the number of studies examining the health effects of wildland fire smoke. And for the most part, the focus has been on wildfire smoke and not prescribed fire smoke. But while the wildland fire smoke literature is relatively new, it is rapidly expanding. However, this doesn't mean that we don't have an understanding of the health implications of smoke exposure. We have decades of research examining both short and long-term exposures to ambient PM 2.5. And by ambient, I mean exposures that are occurring during a typical day and not during extreme events such as a wildfire. These studies of ambient PM 2.5 provide a rich and extensive evidence base that is the starting point for what we know about wildland fire smoke. Across these studies, the focus has tended to be on short-term or daily exposures and health effects. And when we assess that evidence base, it is evident that there's no concentration of PM 2.5 below which health effects do not occur. Additionally, smoke exposures can lead to a range of health effects. This occurred from less serious, such as eye irritation and runny nose, to more serious, such as exacerbation of pre-existing respiratory and cardiovascular diseases, and even premature death. In the last few years, some studies have been conducted that try to assess the health implications of smoke exposures occurring within and across years. And as we've had this increase in wildfire acreage being burned, there's communities that are experiencing smoke, not during these traditional daily exposures that we've often been accustomed to, but now these more sustained exposures occurring many times within a year or across years. But the evidence for the health implication of these exposures is still quite limited over these newer timeframes that we have not experienced in the past. But we do know that when we look at the ambient PM 2.5 literature, that longer exposure durations are also associated with numerous health implications. So similar to our understanding of wildland fire smoke and health overall, our understanding of those populations that are at increased risk of potential health effects is rooted in evidence from studies of ambient PM 2.5. People may be at risk of health effects due to inherent factors that may predispose them to experience a health effect, or in response to being exposed to higher concentrations of PM 2.5. This latter point is important in the context of wildfire smoke because some populations, such as people of low socioeconomic status or outdoor workers, may not have the means available to reduce or mitigate exposures. And it's important to recognize that everyone will respond to wildfire smoke differently. And the presentation of health effects in response to smoke exposures can vary. For some people, it may be immediate, or for others, they may present with health effects a few days later. So to put the public health implications of wildfire smoke into context, here's an example from a project I was involved in with colleagues from the CDC around the Canadian wildfire smoke episodes that occurred last summer. And so in this analysis, we examined the relationship between PM 2.5 concentrations during the smoke episodes and asthma ED visits as collected by state syndromic surveillance systems. And the syndromic surveillance systems capture in almost real time people entering the emergency department. And through this analysis, we saw an observable increase in asthma ED visits during periods where the air quality was the worst. So this is depicted on the two figures on the right-hand side of this slide. And this is specific to Department of Health and Human Services Region 2, which includes New York and New Jersey, which was some of the biggest impacted areas during the Canadian smoke episode. So on the bottom panel, this is representing the air quality index or AQI categories during the periods around the smoke episode. And Sarah's going to talk about the AQI a little bit more in her part of the presentation. But in short, any color that's not green in this figure is representing air quality becoming unhealthy. So when we compare the air quality pattern, these air quality index categories, to the pattern of asthma ED visits, which is the top panel on the right side here, we see that when the air quality was at its worst, there was a marked increase in asthma ED visits that were above what was expected based on the prior 2 weeks of visits. So you see this clear relationship between smoke exposure during a very extreme event and increases in asthma ED visits. And so on the previous slides, I provided context around the current landscape of wildfire and the public health implications of smoke as a means to set up the remaining discussion on prescribed fire, which is one of the main tools that's being implemented to combat the wildfire crisis. And so for a little bit of background around prescribed fire, this is a land management tool that has measurable ecological benefit. It has been shown to improve ecosystem resilience during wildfires. And there's instances where it has been shown to potentially reduce the risk of catastrophic wildfire. Prescribed fires are conducted during specific times of the year when weather and ecological conditions meet specific criteria. And much of the focus around the planning of prescribed fire is to try and minimize smoke impacts and ensure control of the fire so it does not impact surrounding communities. And so the reason that there's been a big push for prescribed fire is because we are seeing a larger increase in the number of large wildfires, which is defined as fires over 1,000 acres. But we're also seeing an increase in the likelihood of wildfire ignitions based on a number of the factors that I talked about earlier, including over 100 years of fire suppression, the changing climate, and the increase in the number of people that are living in the WUI and closer to these wilderness areas. And so, interestingly, the distribution of wildfire and prescribed fire varies fairly substantially across the United States. So if you look at the left-hand side of this slide, this is providing a pie chart of acres burned due to wildfire and prescribed fire nationally based on US EPA's 2017 National Emission Inventory. And you can see that based on the green, which is representative of prescribed fire, it's very heavily dominated in the eastern US, particularly in the southeastern US. And then on the right-hand side of this slide is a recent figure from a study by a paper by Biedler et al., which is showing the spatial distribution of prescribed fire and wildfire, which is really it's further highlighting that prescribed fire is predominantly used in the southeastern US and less so out west, but that is starting to change. So in response to the wildfire crisis, the White House released a strategy to combat this crisis, of which one of the main points is treating hazardous fuels effectively. And as part of this strategy, in 2020, the Forest Service released a 10-year strategy and in combination with the Department of the Interior, made it a goal to treat 20 million acres on national forest lands with an additional 30 million acres on other federal, state, tribal, and private lands. And recent legislation invests heavily in fuels reduction, specifically prescribed fire through the Bipartisan Infrastructure Law, as well as the Inflation Reduction Act. And so as part of the crisis strategy, the Forest Service initially identified 10 priority landscapes and added another 11 in 2023. And since their inception of focusing on these 21 different priority landscapes, they've treated over 1 million acres of land. But nationally in 2023, the Forest Service, in combination with the other partners, have treated over 4.3 million acres, and about 2 million acres of this was due to prescribed fire. And so as we were starting to see an increase in prescribed fire, questions began to arise regarding the potential trade-offs between wildfire and prescribed fire with respect to the air quality implications and the corresponding public health impacts of the smoke emitted. So in 2020, at the request of the Wildland Fire Leadership Council, which is also, you might also hear referred to as WFLIC, EPA led an interagency assessment that included colleagues at the Forest Service, the Department of the Interior, and the National Institute of Standards and Technology, or NIST, to examine the air quality and public health impacts of prescribed fire and wildfire under different fire management strategies. And we approached this assessment by focusing on 2 case study fires in the Western US, one in Oregon and one in California. And overall, the analyses showed that prescribed fire can potentially reduce the overall size of a future wildfire and the associated health impacts that are coming from smoke from that wildfire. But this is also predicated on a wildfire entering previously treated land. In addition, we showed that prescribed fire can result in smoke-related air quality and public health impacts, but potentially at much smaller scale than what we see during a wildfire. However, there are many nuances to these conclusions, as the focus was on 2 case study areas that had specific land management and fire management strategies that were unique to those areas. And as such, the results of this analysis are really limited to those areas, but we did learn a lot through conducting such an analysis by comparing prescribed fire and wildfire. And so even though the CAFE report answered some of these initial questions around trade-offs between prescribed fire and wildfire and the corresponding air quality and public health impacts, we left that analysis and assessment with many remaining scientific questions that we were unable to address. And a few of the bigger ones that we continue to grapple with are, what are the patterns of smoke exposure communities may experience from wildland fire? We see this increase in prescribed fire, and people will experience more prescribed fire smoke exposure. And understanding these exposure patterns, in addition to the wildfire smoke exposures that will inevitably occur, are important in the context of public health protection and whether there's certain communities that might receive more prescribed fire smoke than wildfire smoke, and ensuring that appropriate actions are being taken to protect those communities. Additionally, there's a remaining question of how does wildland fire affect the scale of smoke exposure? You'll often hear statements around prescribed fire like some smoke now for less later, but this is an unknown. It requires it being a given that wildfire will enter a previously treated land and result in less smoke emissions. But the limited evidence to date shows that this frequency of intersection between a wildfire entering previously treated land is quite low. So in reality, it may be that the increase in prescribed fire actually is increasing the amount of smoke in the air overall versus tipping the scale to less smoke in the air. But there's one difference between prescribed fire and wildfire that I haven't touched on yet, and that is that prescribed fire presents an opportunity to prepare communities in a way that's not necessarily possible with wildfire. And that's what I'm going to focus on in the rest of my slides. And so while various programs exist to prepare communities for wildfire smoke, including smoke-ready programs, as well as the Interagency Wildland Fire Air Quality Response Program, which disseminates air resource advisors, or ARAs, during wildfire events. To date, such preparedness efforts have not been common around prescribed fire. But prescribed fire really provides this opportunity we don't have with wildfire of knowing the exact day in which smoke will occur so that we can inform and prepare communities, especially those individuals that are at increased risk of experiencing health effects, of how to reduce their smoke exposures and protect their health. And it's because of this that we wrote a commentary, myself and some colleagues, in the American Journal of Respiratory and Critical Care Medicine last year on this topic, and I'm going to touch on that in the remaining of my slides. So some of the challenges that we experience around prescribed fire revolve around communication of information, and how, in many instances, public health implications of smoke are ignored. Often communications have been framed around, there is some smoke, it may only be here for a few days, so it's not that big of a deal, or smoke is not from a wildfire, so don't call the fire department, or focusing on public acceptance of smoke, which gets back to the some smoke now for less later point I raised earlier. And we've even heard some statements that prescribed fire represents good smoke. And so, as I've touched on already, there's substantial scientific evidence of the benefits of prescribed fire. But with the increase that is occurring, it is unclear what impact this is going to have on the total amount of smoke being emitted at larger spatial scales. And so, thinking back to the discussion of the CAVE report, in that analysis, we were focusing on 2 case study fires. We weren't expanding out that assessment at the regional level or at the landscape scale, which is how much prescribed fire is going to have to happen in order to have some of the achieved benefits that are being anticipated. And so while studies have shown that prescribed fire can emit less smoke than wildfire, there are still numerous issues that we need to consider as we try to balance land management and protecting public health, including understanding disparities in exposure and identifying communities that may be disproportionately impacted. Prescribed fires have traditionally been conducted on a rather small scale, on average about 250 acres in the west and about 50 acres in the east. But to achieve the goals of the crisis management strategy, which is this enormous scale of prescribed fire that's being anticipated, there's starting to be a transition to larger prescribed fires, over 1,000 acres or larger at a time. And then lastly, climate change is playing a role too in increasing the length of the wildfire season. And as the wildfire season gets longer, it's also reducing the windows and optimal conditions for which prescribed fire can be conducted. And so when we think about the ability to reduce the public health impacts of prescribed fire smoke, it's really predicated on a number of factors. And a few of these I'll touch on in more detail in subsequent slides, but it's the ability of people to reduce their exposure. Do they have the agency to do it and the resources? How long are people being exposed to smoke? What's the size of the population that's being impacted by smoke? What's the percent of the population at risk? How many people have asthma in the area in which they're experiencing smoke? And then ultimately the smoke concentration, how much smoke is being emitted into the air and affecting the population. And so when we think about, how do we go about trying to reduce population exposure to smoke? There are actions that occur during the planning phase, which are referred to as smoke management practices. And these are meant to reduce smoke exposure to communities and overall air quality impacts, but often there's a lack of communication with communities and at-risk individuals that smoke is coming. And as I touched on earlier, for a long time, the message was not about the health risks of smoke and how to reduce exposures to protect your health, but instead just letting people know the smoke was there and not taking that next step. So the first step in smoke exposure reduction is really communicating to the public the health risks. Obviously, there are many factors that ultimately influence the ability of people to take the recommended actions. such as behavioral factors and demographic factors, as well as housing characteristics and access and availability to exposure reduction measures. But ultimately, the ability to take the recommended actions, lots of work is happening across all levels of government to provide access to exposure reduction measures to people. This includes some NGOs working with air quality departments in states to get air cleaners to at-risk people, air cleaner loan programs, and research on developing do-it-yourself air cleaners. And so while we are seeing advancements in the science, when we think about the additional information needed to protect public health from prescribed fire smoke, the scientific questions that remain revolve around better informing risk management, risk communication, and exposure reduction actions. And so the commentary that I talked about, that I introduced a few slides ago, within it, we outline a number of questions that we think still remain regarding understanding prescribed fire smoke and exposure patterns and what that ultimately means for health risk. That if we're able to move the needle a little bit and address some of these questions, it will better help us as we think about risk management, risk communication, and exposure reducing actions around preparing communities for prescribed fire smoke. And so in looking forward, it's pretty clear that the amount of prescribed fire in the US is going to increase. It's been increasing each year since the announcement of the wildfire crisis strategy by the Forest Service. And this is going to require proactive steps to prepare individuals and communities that are rooted in our current preparedness, response, and recovery efforts around wildfire smoke. It's also going to require increased coordination between prescribed fire practitioners, public health agencies, and healthcare providers, ensuring that each has the necessary information and ability to communicate the risk of smoke exposure and the actions that people can take to protect themselves. And Sarah will talk about this more in her slides. And lastly, EPA has made significant investments in the past several years to increase cooperation with U.S. land management agencies to try and better align public health goals with land management goals, understanding that this is a very complicated and nuanced process, and each of our agencies need to achieve their underlying mission. But we also need to make sure that we're protecting public health as we try and also achieve our land management goals. And so with that, I'm going to turn it over to Sarah to go through the rest of the slides.
Awesome. Thank you so much, Jason. Now, as Jason mentioned, EPA has been working with land managers and local public health to try to really tackle these questions of how can you do more burning while protecting public health. And to this end, we held 3 tabletops in 2023 and 2024 to identify challenges and opportunities for achieving both of these goals. We had them in California, Oregon, and in the Southeast in Georgia. The one in California on the Stanislaus National Forest, that one is a little bit different than the others because they're already doing a lot of burning. What they want to do is just do a better job informing the visitors, the people who are vacationing there who might not expect to see a giant prescribed burn on their vacation. So they're trying to think of like, how can we work with the people who are coming to visit on this? In Georgia and in Oregon, it was a little bit different. You know, in Georgia, there's a lot of burning in the Southeast, and most of it is being done by private landowners, and there's small burns. So there's just a lot of it, and they're less connected with local public health officials. So the work there is on unpacking communications and next steps around prescribed burning and future attainment designations with the National Ambient Air Quality Standards. In Oregon, we were in West Bend, Oregon, where they have a really close wildland urban interface, that WUI that Jason mentioned. And they're trying to get more prescribed fire in the landscape. They've been trying this for quite some time, but they've run up against a variety of challenges. And so we brought together people at the tabletop to talk about the location and unique challenges and key barriers to scaling up and working across the collection of state, local, tribal, national, and NGO groups involved to try to open up space for more burning. So each place had a little bit of a different flavor to it. Stanislaus particularly about communicating to temporary people. Other locations were about communicating to people who live there. So these started as tabletops, but they've grown into projects really at each location. Next slide. So in Stanislaus, it's a very large project area. The landscape is 305,000 acres. It's a mix of federal, state, and private land. And there's plans to treat up to 120,000 acres of this national forest, and it has a lot of prescribed burning happening. And EPA has been holding regular meetings that include the Forest Service staff and local public health officials and some others to develop messages and strategies to alert visitors to the area about planned burns and ways they can limit their smoke exposure. I want to draw your attention to this on the website for this serial project is an actual link to a whole page about the smoke and why you should be concerned and steps you can take to protect yourself. And it's really kind of unique and neat to see smoke information being provided alongside the ecological and wildfire benefits of prescribed burning on a Forest Service site. So this is an example of what can happen when we bring public health together with land management. Next slide. So this is a postcard that was developed through that project as, again, the idea of really targeting visitors and joining this idea of healthy forests, but also healthy communities. And the back of it has just recommendations on what to do if it's smoky while you're there and steps you can take to protect yourself. So again, this idea of like joint messaging of land management and public health. Next slide. So that was Stanislaw, which again is really focused on visitors. The West Bend prescribed pilot project came about following our tabletop there, and it's focused again on ways to increase the pace and scale of fuels treatment to address wildfires while minimizing negative public health impacts. And the team's really prioritized working with coordinated communication among all the partners to try to get a lot of burning done while protecting vulnerable members of their community. An example here is messaging that went out to people who have a lot of really vulnerable folks, people are really at risk from smoke under their purview. So we had advice going out to nursing facilities, assisted living, adult foster care, like, hey, there's going to be a lot more burning than usual this spring, but we can know about it and be prepared for it and pass this information on to folks, your patients and whatnot, so they can be ready for the smoke. And this went out before the burning happened. Also before the burning, they had a big old joint press release with all the participating agencies saying we're going to have a lot more burning this spring. And here are some things you should know about the smoke that's going to accompany that. So it's this idea of joining forces for common good. And they got about 2,000 acres burned this spring, which is up from about 200 in average year. So they did a lot of burning, but they did also try to get ahead of it with some better public health messaging than you normally see for a prescribed fire and let people know what's coming. And so this idea of working together and trying to present both information at the same time and notifying especially those at-risk groups, which you can really only achieve if you're working within the community and working with like your local public health and your local agencies. So next slide. This is an example of one of the things that came out of that project. This is a 2-pager that was available in Spanish and English. And on one side, they had information about the burns that they're planning, why they're there, what they're doing. On the other side, had information about the smoke and why people should take steps to protect themselves and some of those practical measures that they could take. So again, that joint messaging idea. Next slide. And on that joint statement idea, here we have the Northwest Joint Statement of Intent to Cooperate that was signed this year by EPA Region 10, the Forest Service, and the state air quality and public health agencies for Washington and Oregon. And this was a document put forth that said, hey, prescribed fire is really important. We need to be doing a lot more of it for the health of our ecosystems and for addressing the wildfire crisis. But we also know that that produces more smoke, and so we need to be ahead of it and taking measures to protect health while we're protecting the health of our forests. And so some of the key statements in there were act with urgency and protect public health, safety, and property, identify limiting factors, be innovative and comprehensive and try new approaches, and just the idea of being bold and going for it. And so they put some of this into action in West Bend this spring. And the plan is to put it into action again next spring in Washington. So we'll be looking forward to see how that project comes about and goes. So next slide. So you might be thinking, okay, so we're seeing some examples of joint messaging, but what is public health's role for wildland fire? And for prescribed fire, it's really very much similar to what you would say for a wildfire smoke event, where you have opportunities to be in there with messaging and planning interventions. So if you're doing messaging for wildland fire smoke, you want to talk about how to find local air quality information and make sure people understand the health risks of smoke and how to reduce their exposures. And it's really important to get in on community planning, especially if there are community wildfire protection plans for your area. If you're in an area that is affected by wildfire, there's a good chance you have a wildfire protection plan underway for your community. And that's a great place to say, hey, smoke is part of fire, and we need to plan for smoke in our community. We need to have an idea of what we can do to help reduce the exposures here. And one of the benefits of getting into, say, your CWPP is if your community goes after a community wildfire defense grant from the Forest Service, they will only fund finished CWPPs. And if you have smoke in that, they will now fund smoke protective behavior, smoke planning for smoke. And that's new in the last couple of years. And then not a ton of those have been funded yet because not a lot of wildfire protection plans have typically had smoke involved. So it's a great way to get into some community planning and say, yes, we're going to address smoke, and there's a chance for funding from the Forest Service to do that. You want to make sure you're in your emergency response plans, smoke-ready plans for your community. There are some examples of this work being done in Oregon and Washington and other places. So it's just a really good idea as public health to get into smoke as emergency planning and plan for it like you would other public health disasters. And you can also interventions, giving out air cleaners or DIY fan filters, giving out respirators, and identifying those buildings in your community that are able to provide cleaner air where people can go and seek some respite. So some kind of basic things you can do in public health to support keeping people healthy during any wildland fire smoke event. Next slide. So telling people, hey, we want to make sure you can identify local air quality. We're going to point you to the Fire and Smoke Map, which is a joint product from EPA and the Forest Service. And this is where you can get information about air quality from permanent monitors, as well as temporary and low-cost sensors. There's information about the fires. If there is an air resource advisor assigned to your area, typically for a wildfire, although they're talking about adding those air resource advisors to some prescribed fire, there'll be smoke outlooks with information you can click on to learn about what you expect to see over the next coming days from smoke from fires in your area. So it'd be neat if they do start adding those for prescribed fire as well. And then just be aware that a lot of locations have state and local smoke blogs. And this is a great resource because you're not always going to be covered by an air resource advisor, but a lot of places do have smoke blogs. I'm in the West, so that's where I'm very hyper-focused, but I know Montana, Idaho, Washington, Oregon all have state smoke blogs. There's also some local smoke blogs by people who are really tuned in to their communities. So seek those out if you can and provide that to your public so they understand where they can get information, learn about the smoke that's coming in, and plan their day. It's just a really great resource. Next slide. So all of the colors we've been looking at here are part of the air quality index that Jason mentioned. This is a nationally uniform color-coded index that EPA developed. It's designed to communicate to people whether air quality is healthy or unhealthy, and also inform people when they might want to consider taking steps to protect their health. It takes the concentrations for the for the criteria pollutants and assigns them on a scale of 0 to 500, where that 100 mark is going to be at the short-term or 24-hour National Ambient Air Quality Standard, and it's the demarcation between satisfactory and unhealthy air quality. And I went for that 24-hour average thing, really talking about when this is 4 p.m. And that's during a smoke event. The AQI you're going to be seeing is typically going to be for the fine particulate matter in smoke. So that level between yellow and orange is going to be set at that 24-hour short-term National Ambient Air Quality Standard. And then as the colors deepen, as we get higher up the index, just more and more people need to be taking steps to reduce their exposure. It just means that the smoke is getting worse, and you want to be ratcheting back your activities and taking steps to clean your indoor air and avoid the smoke exposure. So it's just a great communication tool to kind of let people know, hey, on the scale, here's where we are right now. So next slide. So here we have a really great way of looking at exposure reduction actions put together by Zhu et al. And if you're doing anything with hazard reductions, you've probably seen this idea of elimination, engineering controls, administrative controls, and PPE, where your best thing you do is eliminate the hazard. And for wildfire smoke, that's going to be by leaving the area entirely, just get out of it. But that's not practical for a lot of people. Not a lot of people have that mobility, that freedom of just picking up and leaving an area that costs money. We have jobs, we have families, we have pets. Like, it's very hard to do. So if you can't just leave an area, and also sometimes the smoke is going to cover multiple states at a time. And where are you going to go? So it'd be great, but not super practical. So the next best step is engineering controls. We create those cleaner airspaces. We have a way to get out of the smoke and give yourself access to clean air, give your body a break, and really reduce your exposure by creating clean air. The next most effective thing is going to be administrative controls, that idea of changing your behavior. So staying indoors, just going inside does reduce your exposure compared to being outside. And then reducing your physical activity, that's going to just kind of honestly just cut down the amount of smoke that you're breathing in, because the more active you are, the more you're breathing, the more you're just bringing smoke in. So you want to kind of slow your roll and not be as hyperactive when it's really smoky outside. And then finally, respirators are an option for PPE. That's where, we recommend a NIOSH certified N95 respirator. It will reduce exposure. The caveats here is they are hot and uncomfortable, and they don't come in children's sizes. And it can be really hard to get a good seal if you have facial hair. So it's not for everyone. And it's not a fun thing to do, to wear a respirator. I think we've all gotten kind of familiar with that. But if you have to be outside and it's really smoky, or you're someone who's really at risk of health effects from the smoke, it's an option and something to think about. Okay, next slide. So when we're talking about exposure reduction, creating a clean room, those engineering controls, this is easiest done in a home, in my opinion. And for this, you want to make sure that you are avoiding creating your own air pollution. We as humans make a lot of our own air pollution just by existing. So avoid stovetop cooking, even roasting things. Like I roasted Brussels sprouts yesterday. It made my house very smoky. So think about your cooking activities and how much smoke that's producing. Avoid things like smoking, lighting candles, lighting incense, doing things that produce your own air pollution. You want to be reducing that when it's smoky. And then you want to clean your indoor air. And for this, a portable air cleaner with a HEPA filter is going to be your best bet. No matter what, you want to make sure your air cleaner is not generating ozone. Some things are marketed as air purifiers that they cut down smells too. And a lot of times they might do that by generating ozone. And ozone is really bad for you. So you want to make sure that your air cleaner does not generate ozone, which is why we typically lean toward mechanical filtration with a HEPA filter. You want to make sure the air cleaner is sized appropriately for the room that it's in, that you're going to be looking at the clean air delivery rate, or CADR. And you want to make sure that matches the square footage of your room when we're talking about for smoke. That's a current recommendation. So make sure the CADR value is the same square footage of your room. And just be aware that it's based on the assumption of 8-foot ceilings. So if you have really cavernous ceilings like I do right now, you're going to need to really up the ante on how big of a machine you have. And then be aware of the noise. If you have a really noisy air cleaner or it has an obnoxious pitch, you will turn it off. I have done that. I have turned off an air cleaner someone gave me to try out because I hated the noise. I was intolerable. So just be really aware of that as you're thinking of selecting an air cleaner for a space. And then close doors and windows and make sure you can recirculate air through that filter and clean it up. You also want to make sure you can stay cool this entire time. And this is where, unfortunately, if you don't have air conditioning and you have to cool your home down at night by opening windows, you must do that. Heat is immediately dangerous to life and health. And so it's this terrible bargain of, if you don't have air conditioning, you have to let smoke into your home at night. You have to cool your house down. And then once you reach temperature, close doors and windows, turn on the air cleaner and clean things up. So that's the unfortunate bargain there. But if you have central air conditioning, if you're fancy like that, you can actually use your central air handler to clean all the smoke in your home by putting a better filter in that central air handler. The caveat here is that a better filter can sometimes create pressure drop, which is essentially the air flowing across the cooling coils is going to slow down because it has to go through this really good filter first. And some older air handlers, they can't cope with that. And you have a risk of your air conditioning coils freezing up. So you have to investigate this and make sure that your air conditioner can handle that reduced flow by having a better filter in there. And if it can't, then you need to go the air cleaner route, the standalone air cleaner, and you use your regular filter, or don't use your air conditioning and just run the fan. And the other thing with air conditioners is you need to make sure your fan is always running, because if you have your fan tied to your thermostat, you're only going to get air cleaning while you're actively changing temperature. And then just a note on the filters, we say here MERV 13 rated filters, what we recommended. And MERV stands for Minimum Efficiency Reporting Value. And that's just a scale that describes the effectiveness of a filter at removing different sizes of particles. So the higher the MERV, the more effective it will be at removing smaller particles. And MERV 13 is the lowest rated MERV for that's been tested to take out the really small particles in smoke. They're less than even 1 micron in diameter, and those ones we really care about. So that's a lot of information, but next slide. So if you don't have a portable air cleaner, you can make one on your own. I know we've presented to Neha before on this in the past. Those portable air cleaners, what they are a fan and a filter. So you can make your own with a fan and a filter. Get yourself a MERV 13 filter, smack it on the back of a box fan, and you have an air cleaner. We tested some of these in our laboratory to see how they stack up against commercial air cleaners. And the basic version is about as effective as a small air cleaner. As you add up the surface area filtration, you get better cleaner delivery rate. You can use it in larger and larger rooms. But you have a 4-inch filter on the back of that. You have much more surface air to go through. You're going to get a lot more air cleaned a lot faster. It can be used in a larger room. If you make a triangle with your filters or a cube with your filters, again, you're increasing the amount of surface area and you're increasing the cleaner delivery rate, and you can use it in larger rooms. So next slide. And then just a quick caveat with DIY air cleaners, you do want to make sure you're using a newer box fan manufactured since 2012. So it'll have safety features and won't be a hazard. Some of those old box fans, they sometimes caught on fire, which is bad during a smoke event. But the new ones have safety features, and that doesn't happen anymore, which is great. So make sure it's a newer box fan manufactured since 2012. And then as those filters get dirty, you're going to want to replace them. And then we have this great graphic available on our website in English and Spanish. Take it, use it, share it for how people can make their own air cleaners if they can't buy one. So that was things we can do for homes. We can go to the next slide, and we'll talk really quickly about commercial buildings and schools. One of the challenges with commercial buildings is the commercial HVAC systems are designed to take outside air and bring it inside. And there's no requirement that air be cleaned to any level. When you're talking about those MERV filters we were talking about, typically in a commercial building, you will find a MERV 8 because that's all that's required. ASHRAE, which is the organization that sets the standards for commercial HVAC systems, they only require a MERV 8 in commercial buildings. And that's in most locations, that's what you're going to find. But ASHRAE has happily gotten really interested in this question and have come to the table to say, hey, we're going to set standards for wildfire and prescribed fire smoke. We're going to put out guidance. So they issued their first planning document in 2021, and they have really formal guidance that should be out by the end of this year for what these commercial buildings can and should be doing to protect their occupants from smoke. And the reason we care so much about this is because we studied it at EPA. We did a study in Missoula, Montana, and Hoopa, California, to see how much smoke is coming into commercial buildings. And it was a lot more than we wanted to see. And we learned a lot along the way about what was influencing that. So real quick, do the next couple of slides, where some of the structural and operational factors of the HVAC system was affecting indoor air quality. So go ahead and go to the next slide, please. And some key points to keep in mind during smoke events, things that we found affected this, type and condition of filters. You really want a higher efficiency filter. We had a really hard time finding any high efficiency filters. We looked at 20 buildings in Missoula and found 2 that had anything other than a MERV 8. Some had less than a MERV 8. So just be aware that you might not have very many people using efficient filters just naturally in your community. You want to think about when your HVAC system is operating, because when you turn it off to save energy, that's normally great, but it means you're not recirculating air through the filters. It's not getting cleaned. You might also be saving energy by using an economizer, which at night will bring in cold air. So you run your air conditioning. Normally, fantastic. But unfortunately, during a smoke event, you're just bringing in cold air, cold, smoky air all night long. And that just brings so much more smoke into your building. And then think about, is your HVAC functioning? You might be getting the correct temperature, but there can be so many things that are affecting the amount of smoke coming inside because you have non-functioning HVAC components. For example, the dampers that regulate the amount of air that comes into a building, sometimes they're broken open. And that just means smoke just constantly comes inside. Other times broken closed, which is helpful during a smoke event. Sometimes they're warped, which means smoke's going to come inside and it's just not getting correct airflow. So be aware of that. And then there are older buildings with gaps and cracks around doors and windows can be letting in more smoke. So next slide is my last formative slide. So some things that we found, damaged filters and overloaded filters that were so dirty. And when you have a really dirty filter, smoke's not going to go through that. It's going to go around it. It's like life in Jurassic Park. It's going to find a way. It's going to go around it. We also had filters like were jammed in and didn't fit their casing, and smoke's going to go just like through those gaps. There were leaky ducts. There were holes in ductwork. There were filters that were not even MERV 8s. We found some MERV 4s, some MERV 5s, basically going to capture bug parts. There's leaky doors and windows and warped dampers. So all of these things will affect how much smoke is coming into your building. So one of the best things that can be done for commercial building is just HVAC maintenance, just going through and fixing everything so you can maintain positive pressure, make sure you're only getting the airflow inside that you want, you're circulating air through a good filter. All of these things will help make sure your air quality is better inside that building. So we've learned some good lessons, happy to pass it along, and we're really excited that ASHRAE is going to have a very formal guidance going over all of this coming out at the end of this year. So the next slides are just some references for you on things you can look for more information. We have our resources right there, and then we include on this slide deck just all of the actual URLs for every single citation and reference we have here for your use. So with that, we are done and so happy to take any questions.
Thank you, Sarah and Jason, for your presentation this afternoon. We do have a question in the chat that I do want to share. Someone had asked if you have any links to the handouts that have been presented in your presentation today.
Yes, every handout that we have that belongs to EPA, we have on the web, our slide deck. We put those URLs in there. The things that were part of Cyril and West Bend, I don't have links for those.
Thank you. They're asking from slide 33 specifically, which is talking about what to know about smoke during prescribed fire season from the West Bend prescribed burn pilot.
Yeah, that one I think I can probably get that one. I don't have it right away. It was given to me as a PDF from people working on that project. So
thank you. So wondering if you, Jason and Sarah, could also potentially discuss the types of materials that are burned in wildfires versus prescribed wildfires, and if they have different health effects on people.
Sure. So I guess it depends on where the wildfire is burning. So the majority of wildfires are burning biomass, the same as we see in prescribed fires. The difference tends to be the intensity of the burn and how much smoke is being produced. But obviously, you have instances where wildfires will burn through communities and burn human-made structures and materials. And that's where you could see a big difference in the types of chemicals that are being emitted. At this time, we don't have any evidence to indicate that the health effects from prescribed fire smoke are any different than what we might see from wildfire smoke. But there's not been a lot of research on fires coming from burning of the WUI. And so those are just so hard to try and measure the smoke coming from those situations because they end up being super fast events that oftentimes will burn through entire communities within an hour or 2 hours. And so it's really challenging to get the monitoring there to be able to measure some of that. And in many cases, the monitors are burned when the communities are burned. And so there's been a little bit of work that EPA has done to try and think outside the box of how can we get a better sense of the types of exposures that are coming from those WUI fires, whether that's relying on monitoring data that's near where some of those fires were. We had a paper come out a couple of years ago that showed increases in lead concentrations around the campfire that was in California. And then we also have some experimental studies that folks have done in the lab where they're using materials from military burn pits or other similar types of burning of man-made material, human-made materials, to try and get a sense of what does that smoke look like and what are the health implications. And they do see some differences in that context, but again, trying to translate that to what that means from a human health and the exposures people are getting, it's still in its very early stages.
Can you also talk a little bit about any best practices for communities to communicate prescribed fire plans and provide any guidance on health risks and interventions?
I think that with this, it comes with needing to form those partnerships within your communities with the land managers, so you know what their plans are and you can talk to them about making sure you have joint messaging and put out things together so that because the Forest Service knows when they're burning, they will sometimes when land managers make a decision when they're going to burn, and sometimes they make a decision until the day before of exactly when a fire is going to happen. So we're waiting for it to reach prescription, have like the correct relative humidity, correct wind speeds on the surface and the transport winds, making sure the dispersion is going to be ideal and if it's going to carry the flame, how they want it to carry a flame. And so the actual day of when the burn is going to happen, you in public health only are going to know that if they tell you or you're involved in smoke management and you're part of that decision-making process, which in Missoula, where I'm from, we are, but that's not always the case in a lot of locations. So you need to form those partnerships, you know when it's going to come. And then you want to make sure that you can follow the examples put forward in West Bend of in the beginning of the season, say, hey, we're in prescribed fire season. We're expecting to see smoke. We know some burns being planned. And here's what you can do to prepare yourself for when those fires do happen. And by the way, that means you're also going to be prepared for wildfire season when that comes along. And just trying to get ahead of the season, just as we would for wildfires. But it really comes with partnerships of getting to know your land managers and working together on joint messaging plans.
Thank you. Looks like we have another question in the chat asking if you have any guidance specific to private landowners who burn for agricultural purposes.
I mean, I don't know that we have formal guidance on that particular question, other than if you are a landowner seeking to do burning, it's always really great to try to aim for a day that's going to have good dispersion and is not going to cause a problem for your neighbors and community. And it's also a great idea to let your neighbors know what you're doing and so the people aren't surprised and can prepare for it. So it's again that idea of having that good communication up front of this is the plan, this is how long we expect there to be smoke, and then here's what people can do to protect themselves. And how those decisions are made about when burning happens varies so much across regions of who's making that call, if it's a good burn day or not. Is it the private individual or is there a regulator saying burning can happen or not? Or is just the fire department saying if it's safe or not? It's going to vary based on where you are. And that's not something I can really say specifically what you can and can't do just based on differences of where you are affecting that. But always encourage people to be good neighbors and make sure people know what's happening and try to plan for when their smoke won't cause a problem.
Thank you for those insights. With just 1 minute left, I do want to give a special thank you to Jason and Sarah for your presentation. I also want to say thank you for our audience for attending today's webinar. Following the closing of our webinar, you will all receive a request to complete an evaluation survey where you will have the opportunity to provide your thoughts and suggestions on our webinar. So make sure to please complete the evaluation. We really appreciate your feedback. It helps us be able to meet your needs that are needed in the field. So thank you everyone again for attending. Have a wonderful day and we hope to see you next time.